Hello everyone. Good evening all. Hope you all are doing well. Let's start our today's roleplay session. We are discussing random cases. So who wants to do roleplay? You can write your name on the chat box and we can start. Okay, Dr. Tarsila, are you there?
Yes, I'm here.
Hey, this is your case and your 2 minute starts now.
Mm-hmm. I believe I'm ready.
Okay, let's start.
Hello, Rachel and Julia. My name is Tarsila. I'm one of the doctors here at the GP practice, and I'm going to see you today. How are you doing?
Hi, doctor. I'm actually concerned about my daughter because she's complaining headache for last few months, doctor, and I'm really worried about it.
For how many months has she been having these headaches?
I think like few months, more than like 3 or 4 months.
Okay. And these headaches, how often do they happen? Like how many times a week or how many times a month have they been happening?
So every day she's complaining about headache, doctor.
Okay. All right. And where about in the head is the headache?
It's she mentioned like it's all over her head.
All right. And is there a specific time of the day that the headache is worse?
She's complaining mostly in the morning.
Okay. And anything that makes this headache worse?
No, doctor.
If she looks to the light or if she listens to sound, does that annoy her?
No, she didn't mention it.
Okay. Mm-hmm. Okay. And by any chance, before having the headaches, does she see does she complain of seeing things in rainbow or seeing black spots, anything of the sort?
No, but she's complaining about some vision problem, doctor.
Okay. What kind of vision problem do you know?
She's complaining she's seeing something like double.
Okay. And when does she see double?
When she's having headache.
Okay. If she's not in the headache, does she see double?
It's like she's complaining about on and off.
Okay. All right. Is she being able to read the notes at school?
Yeah, I think so.
Yeah. Okay. All right. Has Rachel developed any kind of weakness in the arms or on the legs?
No,
Any fits that she has had?
no, doctor.
Any weight loss?
No,
Have you noticed any kind of discharge from the breasts, like milky discharge from the breasts?
no, doctor.
Okay. Has she been having fevers, chills?
No,
All right. Um, and what about any recent sinus infection or facial pain?
no, doctor.
Okay. Does she complain of pain to the eyes?
Uh, I'm not sure, doctor.
All right. Okay. And a little bit more about Rachel. Does she have any medical issues?
No, doctor.
Does she take any medication every day?
Um, no medication she's on.
Has she ever been admitted to hospital or done any surgeries?
No,
Are her immunizations up to date, her vaccines?
yes, doctor.
Any allergies that we know of?
No,
And in school, is she doing well in school?
yes, doctor.
And at home, who lives at home?
Me and my partner.
Okay. And is everything all right at home?
Yes, doctor.
By any chance, is she going through any kind of stress in school, at home, or in any other environment?
I'm not aware of that, doctor.
Okay. All right. So I'm going to do an examination on Rachel, okay? I'm going to get her vital signs. I'm going to get her temperature, her blood pressure, respiratory rate. All right. Fantastic. All right. So I would like to know, okay, so she has got papilledema. Okay. Um, can you go back to the first slide, please? All right. So, Julia, I believe that Rachel is having a condition that increases the pressure inside the brain. Have you ever heard of intracranial hypertension?
What's that?
So sometimes we can have some issues to the brain. It could be, for example, the draining of the fluid that we have fluid all over our brain. So sometimes the draining of the fluid is not adequate. Sometimes we can have some kind of growth in the brain. And this can cause the pressure inside our skull to increase and cause these kinds of changes that these symptoms that Rachel is presenting. So what I'm going to do with her is I'm going to refer you to the emergency department. I believe it's better if we call an ambulance, we do an emergency transfer because we have to investigate what is the cause of this increase of this pressure inside the brain. All right. While she's here in ED, I'm going to insert a cannula. I'm going to insert 2 cannulas. I'm going to draw some bloods. And we'll wait for the ambulance to transfer. I do understand that what I'm telling you is a lot. So I would like to make sure if you're understanding what I'm saying and if you're keeping up with my explanations.
So, doctor, is it a serious condition?
Yes, it could be a serious condition. It depends what is the underlying cause of the increased pressure inside the brain. But every time we have a raise in the pressure inside the brain, it is considered an emergency condition, and it is an indication for emergency imaging of the head. So likely when she goes to hospital, she'll need a scan of the head to check what could be causing this kind of increased pressure.
Okay, your time's up.
All right, thank you.
Yeah, Doctor, it was really nice performance. Most of the thing you covered.
Thank you.
Did you book your exam?
Yes.
Okay, all the best.
Yeah, in August. Still have
Okay.
some time.
Yeah, still you have time, but it's really nice performance.
Thank
Regarding
you.
the history, I noticed like you ruled out many differential, but look, patient complaining about headache for like a couple of months, and you noticed like also there is a vision problem. You didn't ask me any like stress occupying lesion question. For example, like due to headache, how about your sleep? And because early morning headache and also nausea, vomiting associated feature, any weight loss
Mm-hmm.
history, those things are missing. Otherwise, like you asked me about most of the differential like sinusitis, I noticed. And another thing, you also didn't ask me any trauma history. And
Yeah.
I also gave you history about vision changes. So you should ask about widening glass or not, any like power changes or not. Okay, those questions are
Mm-hmm.
missing. Otherwise, like nice performance. As you mentioned, it's a increased intracranial pressure. So yeah, like that could be like is an umbrella term. So it could be anything like brain tumor or any mass or any abscess. Like that is really nice performance. Okay,
Mm.
all the best.
Thank you.
No, yes.
Thanks.
So let's discuss the case. You are a GP and your next patient is a 12 years old girl, Rachel, brought by mom due to headache for the last few months. Task is history, fee from examiner, diagnosis and management. So this case, your most common differential should be like sinusitis, migraine, tooth pain, trauma, any like ear pain, space occupying lesion, according to this age group. Okay, so what I noticed, like sometimes this case give you positive finding about papilloedema, sometimes positive finding for a like chronic headache, social issue. And I also noticed recently, like case coming with a vision problem, like diplopia. So always you need to dig more about that vision problem as well. Okay. Um, let's discuss our approach. So ask about site of the pain, offer painkiller after ruling out any allergies. Ask about exactly when did it start? Is it sudden onset or gradual? How long has she been on this headache? What type of pain is it? Is it band-like or crushing or shooting type of pain? Does it go anywhere else? Anything makes it worse, anything makes it better. And also, is there any specific time of this headache? Is it associated with nausea, vomiting? And always ask because, like this space occupying lesion patient will wake up from sleep due to headache. So that is one of the red flag. So please ask about that sleep issue as well, okay? Any vision problem, any pins and needles, or any weakness anywhere of the body. Ask about details migraine question. So migraine history, you should ask about like all the aggravating factor. you need to ask about food, any light, noise, any environmental changes, any history of previous headache or family history of migraine you should ask. Um, then ask about the home situation because it's a chronic headache. You need to also rule out it's not a psychogenic cause. Okay. So ask about primary carer, any stress at home, or how about the school, any history of bullying. Okay. So what happened? Positive finding, patient complaining about early morning headache. Patient didn't have any vomiting history but feels nausea most of the time. And also like uh, patient like took Panadol, sometimes it gets better. Um, and that's like more than 6 months patient complaining about headache and along with some vision problem as well. Okay. Ask about any runny nose, any eye problem. Are you wearing any glass, any like previous vision issue? Ask about any infection history, any fever, cough, cold, sore throat. Ask those things. And as I mentioned, like any neck stiffness, because meningitis, that's the more acute kind of thing. So ask about any trauma history, any third nerve palsy can cause that vision problem, but that is also less likely if that is a recent injury. And for tumor, malignancy, space occupying lesion, ask about any forceful vomiting. Does a headache wake you up at night? Um, so as I mentioned, if the pain like wakes up the patient from sleep, it is definitely the organic cause. Okay. Ask about any lumps, bumps, any recent changes in weight. Ask about growth, development, any medical surgical condition. Okay. Uh, now, so the positive point based on the physical examination, blood pressure a bit high. Also, there is low pulse and fundoscopy, like it's showing papilloedema. Um, Sometimes you might get like diplopia. So always remember for diplopia cause. So you need to know about unilateral and bilateral diplopia. So if it is a monocular diplopia, what could be the reason? It could be like eye problem, like astigmatism, dry eye syndrome, or it could be due to ill-fitted glass or contact lens, or any iris abnormalities. Okay, and another thing is that for double vision, like binocular diplopia, it could be due to any cranial nerve palsy, any systemic issue like hyperthyroidism, facial trauma, aneurysm, or like, space occupying lesion. Um, and always remember that binocular diplopia needs more urgent attention rather than unipolar diplopia. Okay. So um, explain the condition. So mention to the mom like our brain is surrounded by fluid. We call it is a CSF. This is basically filtration of the blood and absorbed back, and this is done continuously. If there is any interruption in absorption of this fluid or increase in formation of this fluid, it can lead to increased pressure surrounding the brain. And the brain is enclosed in the skull. And if pressure increase, what could be the symptom? Definitely headache, vomiting, increased blood pressure. That's why we call increased intracranial pressure. My current diagnosis is a increased intracranial pressure. And how I can say to you, because when I checked back of the eyes, I noticed back of the eyes also swollen. So most of the time, the cause for increased intracranial pressure could be blockage to that CSF flow. Okay, and the reason behind it, it could be like due to mass, or any solid. That mass could be solid or liquid, and that can cause obstructing feature. So just let you know it's an emergency condition. So I'm going to refer your child to the neurologist, like tertiary level hospital. Then I also inform pediatric specialist before this child being transferred. And in the tertiary hospital, they will arrange further imaging. Okay, so patient mom might ask you, doctor, is it a brain tumor? You can say like, look, without scan, it's very hard to say, but most likely there could be like obstruction that can cause that increase in intracranial pressure. It could be due to any tumor, like any solid or liquid mass. It could be abscess. It could be any infection. Okay. So to know the situation, we have to do urgent imaging of the brain. Okay, but good thing is that we have picked it up early so that we can do any intervention earlier. And please don't be stressed because your daughter is in safe hand. Okay, just mention in this way, and we are going to transfer this patient to the tertiary level hospital. In the meantime, you can arrange blood investigation, arrange transport, liaise with tertiary level hospital specialist, and let them know. Okay. Up to 16 years, you can talk to mom. But if it is like private, like related, for example, any contraception advice, sexual advice, that time, you need to ask about like authority or consent like that. Okay. Um, so in main exam, it will be clearly given either you need to take a history from the mom or you need to take a history from the daughter. Okay, because those are the sample questions. So it's not, STEM is not clearly written, but in the main exam you'll get proper STEM. Okay. Do we need to send her to emergency department or refer to neurologist? Like in this type of case, this is emergency situation. So definitely you need to send this patient to the emergency care. That means like hospital where neurologist or neurosurgical department available. But if you're going to refer to the clinic, that will take ages, okay? 6 to 12 months waiting time. But that is the emergency situation. So definitely it's a hospital transfer. So patient will need either CT or MRI. That will be decided by the specialist. And yeah, it depends. If you are in GP setting, you have to send this patient to the emergency for urgent imaging. Okay. But as I mentioned, like recent case coming as a diplopia positive findings. So please be careful about other findings as well. If it is a unipolar diplopia, I would say, and if other findings are fine, if complain about headache for 6 months, unilateral diplopia, no other positive findings, I would say it could be due to vision problem, okay? Patient might need glass. But if there is like other positive finding, headache, vomiting, physical examination showing there is a bit high blood pressure, papilloedema, so I'd say it could be due to any obstruction of that CSF flow or increased intracranial pressure. So while referring to other hospital, if your patient complaining about headache, you can give symptomatic management, just Panadol. Okay. If it is a GP setting, you can't go for urgent imaging then to neuro consult, like because that's clinic referral, it will take time. So anything urgent, you need to send this patient to the emergency hospital. Okay. So for a history physical examination card, you will get the card. But For physical examination, that's a different story, okay? You need to explain how you are going to do physical examination for headache case, for facial trauma case, which examination, which system you are going to focus and how you are going to do examination. But that is the history case and you will get physical examination finding card. So you don't need to worry about it, okay? Okay, let's move to the next case. Any advice for head elevation? I have no idea about it, sorry. Okay, Dr. Chloe, are you there?
Hello, doctor.
Hey. Just a minute. You can give any symptomatic management, but as I mentioned, like if your patient is in pain, complaining about nausea, you can give Panadol and antiemetic. But our immediate management should refer this patient to the emergency department. This patient needs urgent investigation, especially brain scan, okay? Okay, so Dr. Chloe, are you there?
Yes, doctor.
This is your case and your 2-minute starts.
Hello, doctor. I'm ready.
Okay, you can start. You can start.
Yes. Can you show me the results? Okay. Hello, I'm Dr. E, one of the doctors in this hospital. How can I address you?
Hi, Dr. Julia.
Nice to see you, Julia. So today we are going to discuss about the patient Matthew, who was already who is changed in behavior recently. So I will tell you the investigation results, and then I'm going to ask you a few more questions. Will that be all right?
Yeah, doctor.
Okay, so let's discuss about the investigation first. The patient is Matthew, who is an 87-year-old, and he has been recently changed in behavior and behaves strangely. So, according to the results, what I found is that the sodium level is reduced, and also hemoglobin result is reduced, and then the um, as you can see in the picture, there are some uric acid level decrease and the potassium level is in the normal range. So apart from the other investigations findings are maybe in the normal range. So are you with me so far?
Yes, doctor.
Mm-hmm.
So what
So the patient, hello?
what does it mean, doctor?
Okay, so this means that the patient has low sodium in his blood. So this is called hyponatremia. So to find out the condition, would you mind if I ask you a few questions?
Sure, doctor.
Mm-hmm. Okay, so before yesterday, was Matthew completely fine?
Um, he's okay, doctor. He was okay that time.
Mm-hmm. Mm-hmm. Okay. So can you tell me more about his condition?
What do you want to know?
Yes, how long has he been behaving strange like this?
The last 2 days, doctor.
Mm-hmm. Okay. So is he orientated to time and place?
Not really.
Mm-hmm. Okay. Is he aware of any person?
Sometimes he's aware of that, but sometimes not.
Mm-hmm. Okay. So how was his mood lately?
His mood is not that great, doctor. He's irritable.
Mm-hmm. Okay. So any previous history of memory problem?
No.
Mm-hmm. Okay. So can you tell me more about his water walk?
It's okay, doctor.
Mm-hmm. Mm-hmm. Is there any change in color or any change in amount?
No.
Okay. So is there any change in like any foul smell?
No, doctor.
Mm-hmm. Okay. So does he complain about any back pain?
No.
Mm-hmm. Okay. So, uh, does he got any fever?
No fever.
Mm-hmm. Okay. So is there any problem with his cough?
No.
Any shortness of breath?
No, doctor.
Mm-hmm. Okay. So is there any medications that he has taken recently or regularly?
Yes, doctor. He's taking lots of medication for his
Mm-hmm.
chronic medical condition.
Mm-hmm. Okay. So tell me more about that. Any diuretic?
He's taking diuretics as well, doctor.
Mm-hmm. Okay. So do you know how long has he been taking this kind of diuretic?
Yeah, doctor. I think that is his regular medication.
Mm-hmm. Okay. So does he have any underlying medical problems that I need to be aware of?
He's having high blood pressure, diabetes. He's having heart
Mm-hmm.
condition as well, and also
Mm-hmm. Oh,
diabetes,
mm-hmm. Okay. Hypertension, diabetes, and heart disease, right?
and also osteoarthritis.
Mm-hmm. Okay. So for the diabetes mellitus, what are the drugs that he is taking?
He's taking empagliflozin.
Mm-hmm. Okay. So is there any other medications?
He's taking high blood pressure medication and also
Uh-huh.
osteoarthritis medication as well.
Mm-hmm. Okay. Thank you. So does he got any head injury?
No.
Okay. He is behaving strangely. So tell me more about that.
Doctor, last 2 to 3 days, like is being bit confused, and he's not aware of that where he is now, which is
Okay.
not
So
normal for him.
okay. So is there any history of stroke?
He had a past history of stroke.
So can I know more about this?
As per the medical condition, just past medical history, he had a stroke around 20 years ago.
Okay. So is by any chance he is drinking any alcohol or smoke cigarettes?
Not that I'm aware of, doctor.
Okay. Any recreational drugs?
No,
Okay. So any history of any history of surgery, recent surgery?
no.
Okay, so thank you so much for your story. And so I'm going to tell you about the possible causes of his condition, Julia.
Mm-hmm.
He was previously well, and he is recently confused and behaves strangely, and he is not orientated to time, place, or person. So this condition is what we call delirium or acute organic brain injury. So any idea about that, Julia?
No, what's that?
So it is this acute confusion of the brain, like there is cloudiness of the consciousness. So it may be due to sometimes due to the decreased oxygen or hypoxia, and it is sometimes due to infection and sometimes due to electrolyte imbalance or other problem. But according to his investigations, what I found out is that sodium is reduced in his blood results. So this condition is more likely to be due to hyponatremia or decreased sodium level in the blood. So because of this decreased sodium level, he is acute cloudy consciousness of the brain. So this is called delirium or acute organic brain syndrome. So okay. So, and it could also be due to other problems like infection, but he doesn't have any history of fever or any other respiratory problems like shortness of breath or any other urine problem. So it is less likely. And so it could also be due to other problems like other drugs, but it is less likely in his condition. So I think the hyponatremia is most
Your
probably due
time's
to
up.
because of his diuretic. Okay, thank you.
Okay. Dr. It was really nice, a nice performance. You asked me about the medication history details. That was really nice because that hyponatremia could be due to many reasons, but in here it's a like medication induced. Now coming to the medication history, you asked me about details. So your important question you missed that it was like um, Matthew, did he visit any specialist recently? Any medication changes, medication or dose changes?
Yeah.
Okay, so how do you know this is
Yes.
a medication related? Because if your patient is taking that regular medication for a long time, so why these things
Mm-hmm.
happen just for 2 days? You know?
Yes, I forgot. Yeah, I got
Yeah.
it.
So it's not like all about making a diagnosis, it's all about like
Mm-hmm.
relation. So when you are making a diagnosis and mention like it could be due to delirium, possible hyponatremia, and because of the drug, that could be the reason. But you need to at the same time correlate it because there is recent changes of the medication doses. Okay.
Yes, thank you.
Otherwise, like most of the thing you asked, and now coming to the another important thing, you already made a diagnosis as a hyponatremia delirium case, but you didn't ask me any hyponatremia other symptoms. Okay, what are the
Yes,
symptoms
doctor.
for hyponatremia? Like you didn't ask me any like weakness, any fits, because
Mm-hmm.
patient sodium level is 120. Okay, so
Yes, doctor.
ruled out other hyponatremia symptoms. Okay.
Yes,
So
doctor.
let's discuss the case. Otherwise, the overall is nice performance, Doctor.
Yes, thank you.
No worries. So you are an EDHMO working in a rural hospital. Your consultant asked you to see a patient named Matthew, 87 years old, coming from nursing home. Patient presented to you with confusion, and nursing home manager also reported he's confused, behaving strange for 2 days. Investigation already report given. So your task is you need to make a phone call to the bedside nurse or nurse in charge to discuss about the report, take a relevant history, and tell the possible causes of his condition. Um, so yeah, as per the blood investigation report, like we noticed sodium level is really low. Otherwise, like hemoglobin 109, it's a borderline low, I'd say, but because of the age, and if patient having any other chronic medical condition, I'm not worried too much about this hemoglobin level unless it's less than 70, and having anemia symptoms. Otherwise, like creatinine, okay, uric acid level is little low, potassium is okay. Cortisol level is okay, plasma osmolarity is also okay, urine osmolarity is okay. Plasma osmolarity is a bit low, but urine osmolarity is okay. So we all know about the delirium, what is the causes of delirium. So I always follow the mnemonic of delirium, that is dementia. So D for drugs, depression. Another thing could be hypoxia. E for an endocrine issue, for example, diabetes, thyroid issue. M for malignancy. E for electrolyte imbalance. N for neurological condition like stroke, TIA. T for trauma, I for injury and infection reason, A for alcohol. So ask about, like, if you are talking to any carer or anything, you can give confidentiality statement, introduce yourself and ask about patient identity, and mention like I'm going to discuss with the Matthew blood test report with you. But anytime if you don't understand, feel free to ask me. Okay. So what is that result you notice? Just explain. So as I mentioned, like I have noticed low hemoglobin level. What is hemoglobin? You can mention, but based on the age group, as may I'm going to ask you low hemoglobin question as well. Sodium level is low, potassium all are fine. So at this moment I notice his sodium level is low. We call his hyponatremia. That could be due to many reasons. So may I ask you a few more questions about that hyponatremia? And as you mentioned, he also having that confusion. How long he is having this confusion? Any associated symptom, nausea, vomiting, trauma, injury. Ask about hypoxia related questions. So ask about any short of breath, any fever, cough. Ask about any urine problem, dehydration symptoms, so any nausea, vomiting, fluid loss, urine, any smelly urine or not, any regular medication. Um, does he have any medical condition like diabetes, high blood pressure, thyroid, any kidney problem? Ask about it, and also ask about any weakness. So patient already had a history of a stroke 20 years ago. You asked about any medication he's on, especially any blood thinner like aspirin, clopidogrel, like that. Ask about hyponatremia symptoms, that is irritability, confusion, weakness, seizure, and causes of hyponatremia, as I mentioned, any fluid loss, any heart failure, renal failure history, kidney failure history, liver failure history. Ask about it. So patient having past history of high blood pressure, diabetes, heart condition, stroke, osteoarthritis, and patient is taking list of medication. You should ask like any recent changes of the dose, any recent specialist visit. You should ask. So patient is taking indapamide for high blood pressure, and there is also recent changes in the dose. Okay. So based on the history and blood report, most probably his confusion is related to delirium. what is delirium, ask about it, like it's a acute confusional state of the brain. And that delirium could be due to many reasons, but based on the blood report, I'm thinking it because of the electrolyte imbalance. Our body has some chemical like sodium, potassium, some chemical and minerals that maintains our electrolyte system in our body. But what I noticed, like there is low sodium. It should be normal range should be 135 to 145, but in Matthew case is 120, which is really low. And the reason behind it, it could be due to any dehydration issue, any trauma, malignancy, any medication induced. What I noticed, Matthew is taking medication which is indapamide, and recently there is dose changes, so that could be the reason for hyponatremia. I tried to rule out other reason for hyponatremia. I couldn't find any dehydration, no history of malignancy, no trauma history, no stroke, okay, and no failure history as well. Um, so our management would be, we are going to discuss with the specialist to stop offending medication. If it is indapamide caused hyponatremia, you need to stop the offending medication, but patient is having history of high blood pressure. So discuss with the specialist to switch to other medication, okay? If it is hyponatremia, sometimes we do other like serum cortisol level, plasma osmolarity, serum like serum osmolarity, urine osmolarity level check, which already checked. And if it is we can correct with the fluid, or sometimes we can do fluid restriction, okay? So in that case, you can involve with endocrinologist as well. So just mention about all the basic blood investigation, along with you are going to call your senior, and because you are suspecting it's a delirium in a fast instinct, so you have to do all the delirium screening, okay? So delirium screening that comes as a blood, urine, and imaging. So blood, ABC, UVC, LFT, you can order if there is a fever, you can order blood culture, urine microscopy culture, and imaging. So baseline imaging is a X-ray, okay? So plasma osmolarity, how you can explain in a layman term, you can say, just say, you know, blood concentration. We are also checking sodium concentration in the blood or sodium concentration in the urine. In this kind of scenario, should we have to ask for the investigation finding? So what happened in main exam, you might get just a stem, and when your 8 minutes started, you will get the investigation report. But sometimes in the main stem, you will get blood test report as well, okay? So it depends. If you're asking me now, like it's really, STEM will tell you either will get blood investigation report now, or after finishing the history, you will get the report. Um, for online exam, most of the time, like vital sign would be given on the STEM. If not, you can ask like, first I would like to check my patient vital sign, and then we can start. Look, there is no hard and fast rule how many differential you need to explain, but most common differential, at least you have to rule out, because there is a marking area, like in that result, like if you have noticed any past feedback, you notice there is like predominant assessment area, the approach, diagnosis, differential, management plan, all area you will be marked. Okay, so make sure you are asking or you are ruling out all the relevant differential within 8 minutes. Um, for this case, just for example, for this case, patient blood test showing is a hyponatremia, and another thing is a delirium. You have to mention is the delirium, that is key point, and hyponatremia is the reason for delirium. And what is the reason for hyponatremia? That is the drugs. So that 3 key point you have to mention. Now coming to that hyponatremia causes. So when it comes to hyponatremia cause, so as you know that it can be caused by any fluid loss, any failure history, any increased water intake. That's a reason for hyponatremia, or it could be any drug induced. So you have to ask those things as those question as a key question in here. I think you understand now. Because there is recent changes of the dose. It could be due to a higher indapamide dose, and that's the reason for hyponatremia. Do you have to tell us that I will come and review the patient? If your task is management, definitely you can mention like you are going to review. For any delirium case, you have to review the patient. Okay, so let's move to the next case. Who wants to perform? July. Hello.
Hello. Hello, doctor.
Hey. Okay, this is your case and your 2 minutes starts now.
Okay, thank you.
You can start.
Hello, I'm Dr. Julai, one of the medical officer in this hospital. Nice to meet you, Karen.
Hi, doctor.
Okay, Karen, how can I help you today?
Doctor, I'm not feeling well, doctor, since morning. I'm feeling nausea all the time, and I already had vomiting multiple times, doctor.
I'm really sorry to hear about it, Karen. So first of all, let me check your vitals to make sure you are in stable condition. Is that okay, Karen?
Sure.
Okay, so Karen, can you tell me more about your vomiting and nausea?
What do you want to know?
Yeah, so in the previous day, are you okay?
Yes, doctor.
Okay, so how many times did you vomit today?
Maybe more than 4.
4, I see. And what does the vomiters contain?
Just food.
I see. And so what is the amount?
Um, I'd say just moderate amount, doctor. Whatever I ate, I just vomited.
Okay, I see. And so can you take any liquid?
Was that?
Hello? Can you take any like the water or some liquid?
I can't, doctor.
Okay, I'm really sorry to hear about it. So after the vomiting, do you feel dizzy or tired?
I felt tired. I'm not feeling 100%.
I see. Is this your first time having these symptoms?
Yes, doctor.
Okay. Do you have any history of collapse before that?
Was that?
Any history of collapse?
Oh no.
Okay. And Karen, do you have any history of assisted conception?
Uh, you mean was that?
Like the assisted fertility, like the assisted conception, getting the baby?
No, doctor.
Okay. Any family history or twins pregnancy?
No.
Okay. And do you have any bleeding from your down below?
Yes, doctor. I do have bleeding.
I see. You have the some bleeding in your down below?
I noticed like bleeding from my private area, doctor.
So since when you have the bleeding?
Since morning.
Since morning. And so what is the color of the bleeding?
Just fresh blood.
Fresh blood, I see. And what is the amount?
The amount. What do you mean?
What is the amount of the bleeding? Like how many pads did you use today?
I'm using one pad now.
One pad, okay. Does it contain any vasicles?
No.
Can you see any tissue piece?
No.
Okay. And so may I know your blood group?
O positive.
Oh, positive, I see. Okay. And so apart from the bleeding, do you notice any tummy pain or tummy mess?
No, doctor.
Okay. And do you have any fever recently?
No.
Okay. And do you have any headache or any rash?
No, doctor.
Do you have any belly pain when you pee?
No.
Do you notice any color changes in your pee?
No.
Okay. And um, so Karen, I understand your last period was 7 weeks ago, right? So before that, is your period regular?
Yes.
Did you use any contraception before that?
No, doctor.
So how did you confirm your pregnancy?
I just did the home pregnancy test.
I see. And so have you ever pregnant before?
No.
Any history of miscarriage before?
No.
I see. And have you done your cervical screening test, Karen?
No, doctor.
Okay, I see. And okay. Mm. So Karen, so before your pregnancy, have you ever diagnosed with any sexually transmitted infection before?
No.
Okay. And do you have any other medical condition?
No, doctor.
Are you on any blood thinning medication?
No.
Any history of bleeding disorder in you or your family?
No, doctor.
Okay. And are you taking any drug?
No drug.
Okay. Any allergy?
No.
Okay. And I see. So for the bleeding, is this your first time?
Yes, doctor.
Okay, I see. And also, d does it have any foul smell?
No.
Okay. Okay. And by any chance, do you drink alcohol or smoke?
No.
Any use of recreational drugs before?
No, doctor.
Okay, thank you for all your information, Karen. And let me do the examination on you. Mm. Does it mean that pelvic have the grape life ascites or no? No,
Nail grip.
near grape. Okay, I see. Okay. So thank you. So Karen, can I move to the previous slide, please? Okay. So Karen, thank you for waiting. So Karen, according to the story, I understand that you have been having the nausea and vomiting since this morning. And so when I do the examination on you, I noticed that your pregnancy is larger than it should be. And although you are now having your last period is 7 weeks ago, but when I do the examination on you, I noticed that your pregnancy is around the 12-week size. Okay. So all these features are pointing towards that. So that condition now you are having is due to a condition what we call the hyperemesis gravidarum. Have you ever heard of this?
What's that?
It's a condition which results in the excessive vomiting and is especially common in the early parts of the pregnancy. And normally we have the vomiting in the early part of the pregnancy, but when it became excessive and when it became result in the sudden loss of the fluid in you, and that's at those state we called it the hyperemesis gravidarum. Okay, and for the causes of the hyperemesis gravidarum, there are a lot of causes like the during pregnancy, or sometimes it could be due to the molar pregnancy, or sometimes it could be due to other like the in your case, I'm also thinking about whether it's due to the round date. So I need to check all everything again. Okay. And other causes
Your
include like
cancer.
the urinary tract infection or the meningitis, which is the inflammation of the brain coverings, and also the appendicitis, which is like inflammation of the appendix in our bowel. Okay, so these are the possible causes I'm thinking. So I would like to arrange some investigation for you just to find out what is the exact cause that is causing the vomiting and the bleeding in you. Is that all right with you, Karen?
Yeah, your time's up, doctor.
Okay, thank you.
Okay. Yeah, it was nice performance, Dr. July. So you took a very long history. Like how you took a history that was really nice. You didn't miss anything. That was such a detailed history. But you have to be like careful about your time management as well, because it's
Mhm.
an online exam. Like I
Yeah.
already told you, like your time's up, but you keep talking. So
Oh,
in the main exam, like online
okay.
exam, when your time's like 8 week finish, yeah, you like immediately remove from that performing room to the breakout room.
Okay.
So it's not like that you keep talking and somebody is listening. It's not like that.
Okay,
So
sorry.
no,
I
that's
didn't
okay.
hear you, sorry.
But just let you know, that's why like 8 minutes is really important. So coming to your diagnosis differential, you mentioned about hyperemesis gravidarum. That's perfect, your diagnosis, but also patient having threatened miscarriage as well because of the
Mhm.
bleeding. Okay,
Okay.
missed that.
Okay, I see.
Okay. Otherwise, like you touched all the key point in history, because in here, key point is twin pregnancy, molar pregnancy, ectopic pregnancy, which you already ruled out. That was really nice. But
Mhm.
your diagnosis and differential, one diagnosis you already mentioned is hyperemesis gravidarum, but along with this, there is also threatened miscarriage. Okay.
Okay, I see.
And also investigation part is missing because of the time management. So yeah, if you're doing role play more and more, you might notice like what question you can like still skip. So if you notice like time is limited, you can skip smoking, alcohol, those things. Okay.
Okay,
This
Dada.
is the case. You are a HMO in a metropolitan hospital. Karen, 27 years old female, had nausea and excessive vomiting since morning. Her LMP was 7 weeks ago. Vital stable. Your task is take EST, PV, diagnosis, differential, and investigation. So here you should ask about nausea, vomiting in reproductive age, like early pregnancy. What could be the reason? It could be due to acute gastro hyperemesis gravidarum due to twin pregnancy, multiple pregnancy, molar pregnancy, or any like acute abdominal thing like appendicitis, pyelonephritis, UTI. Um, Nausea, vomiting reason, it could be due to any liver problem like cholecystitis or any ulcer, or it could be due, as I mentioned, UTI, all infection related reason. Okay. So ask about how do you feel? Do you feel dizzy because of the fluid loss? How was your pregnancy confirmed? Is it a planned pregnancy or not? So how many times you had vomiting? Yeah, since when? Color of the vomit? Are you able to keep anything down? Any diarrhea history? Any bleeding discharge from down below? So bleeding discharge, that is the key point in here. Any grape-like structure, that is another key point. Acute abdominal emergency condition like pyelo, appendicitis, UTI, those things. You should ask about any tummy pain, any burning sensation while passing urine, smelly urine. Pregnancy question, is it your first pregnancy? How do you confirm the pregnancy? Have you done all of your antenatal visit? Have you done ultrasound scan? Contraception advice you should ask. Ask about pap smear, cervical screening, family support or family history of twin pregnancy, ask about it. Physical examination, what we noticed, like bleeding present but os closed, and uterine size, like I said, 12-week uterine size, ketone positive, urine pregnancy test also positive, and also there is sign of dehydration. So based on the history and physical examination, most likely you are having a condition, we call it hyperemesis gravidarum with threatened miscarriage. So that is your key point. You have to mention that two diagnoses. Okay. Why these things happen in settings of unstable like pregnancy hormone in early pregnancy? Basically, it starts at 4 to 6 weeks and it resolves like around 20 weeks. And why bleeding happen? Bleeding due to implantation. I wouldn't think it's a serious condition. It's a very common normal body response to pregnancy. And what I noticed, it could be due to wrong date. Okay, as your tummy or your womb larger than it should be, so it could be wrong date of pregnancy. Other differential, it could be multiple pregnancy, twin pregnancy, or it could be due to molar pregnancy, which is not a true pregnancy. No fetus, parts of fetus and vesicle, and producing like excessive hormone. But I don't think it's a molar pregnancy. It could be due to urinary tract infection, gastroenteritis, ulcer, but those are less likely. So I also noticed you are a bit dehydrated. So what I can do, we can manage your dehydration at this moment. Good thing is that you are in safe hand. We'll admit you in the hospital to manage your dehydration. Okay. An investigation, so basic blood, APC, USC, serum, beta HCG, LFT you can order, and ultrasound to check the baby's condition, and you can order urine MCS as well. Okay, if patient didn't have antenatal investigation, you can order all the fast antenatal investigation.
Hello, doctor. So what is causing the larger than date?
What's that?
Because it's mentioned is the 12-week pregnancy and his the last period is 8 weeks ago. So what is the reason behind it?
So patient mentioned her LMP 7 weeks ago. So either it could be due to wrong date, as I mentioned.
Okay, thank you.
So you need to think about ectopic pregnancy as well. If patient complaining about tummy pain, nausea, vomiting, and also coming with bleeding, yeah, your differential could be ectopic as well. But those are less likely in here based on the physical examination. So if patient is unaware about pregnancy, you can still do pregnancy test and confirm whether that is pregnancy or not. Yeah, definitely. That's a good question. Like either she's trying to be pregnant or not, or um, so ask either like because last menstrual period, that was 7 weeks ago, did you do any home pregnancy test or are you sexually active and are you trying to be pregnant? Those questions like you can still ask. But look, as I mentioned, time is one of the issues. So try to cut short your history. Ask about like, have you done your pregnancy test at home? No grape-like structure. Vaginal examination and no cervical motion tenderness. Do we still need to mention the physical examination even if? So for the online exam, you will get PEP card. And my advice would be like explain that PEP card to your patient. Okay. So if I would be in your position, I would say like, look, Karen, I have done physical examination on you, and what I noticed, you a bit dehydrated. You are vitally stable at this moment. Your tummy is fine. I checked your pelvic examination. Good thing is that there is no grape-like structure. Speculum examination I did, and I noticed like your mouth of the womb is closed, but still there is a bleeding. And parvaginal examination, uterine size is a bit larger than you told. But good thing is that there is no tenderness, and office test we have done and it's showing like you are pregnant, that is confirmed. And also there is ketone positive, so it could be due to related to your dehydration. I always advise to my student like explain PEG card to your patient. Okay, so let's move to the next case. Dr. Siddhant, are you there? Hello. Hello, Dr. Siddhant. You want to perform? Okay. Anyone wants to perform, Dr. Anuja?
Hi, hello. Yeah, I want to.
Did you perform with me in last class?
Yes.
Okay. I'll just checking. I'll be checking like who didn't perform with me in last class, and then if nobody, I'll call you then. Is that okay?
No problem. Yeah.
Any new candidate wants to perform? Okay, Dr. Sital Singh. Yeah. Hello.
Hello.
Okay, this is your case and your 2 minutes start now. You can start.
Thank you. Hi, Alice. My name is Dr. Singh, and I'm one of the doctors here today. I'm one of the GPs here today. How are you?
Hi, doctor. I'm okay. Actually, I'm concerned about my daughter Alice. So
Okay.
with mom. Okay.
Okay. Can
Uh,
you can you tell me more about Alice and what brings you to bring her in today?
yes, doctor. I noticed like Alice. She's complaining about some neck swelling, and I'm really worried about it, doctor.
Okay, sure. Sure. I'm sorry to hear that. Let's find out why she's complaining about the neck swelling. Has she had a recent cold or fever recently?
No,
No. Has she had a sore throat recently?
no, doctor.
Is she complaining about any pain where the swelling is?
She didn't complain about any pain.
Okay. Can you point exactly where the swelling is on your neck to give me an indication of where exactly it is?
It's the middle of the neck.
Middle of the neck, okay. And did it suddenly become big one day or did it gradually become big, swell up?
No, she told me she like noticed last couple of like days, maybe 2 weeks.
Okay.
Yeah,
So it's been there the same size for the last 2 weeks?
yeah,
Okay, and it doesn't hurt.
yes, doctor.
Does it move around?
Mm, she didn't mention to me.
Okay, and what about when she eats and swallows and drinks water? Does it hurt or
No,
is she no, okay. So she's still able to eat and drink.
yeah,
Okay. And has this ever happened before?
no, doctor.
Okay. And is there any other swelling on any other part of her body?
No, doctor.
Okay. Has she noticed any swelling, maybe like any pain or little nodules under her armpit or around her neck area?
No,
No? Okay. Has this happened to anyone else in the family?
no, doctor.
Okay. And I want to ask a little bit questions about Alice going back to her when she was born. And when she was born, was everything okay with Alice? Like, was she born normal vaginal delivery or did you have a C-section?
It was like normal delivery, doctor.
Okay. And she wasn't born prematurely or anything like that?
No,
Your pregnancy was okay?
yeah,
Yep. Okay. And her immunization, is it up to date?
yes, doctor.
What about her nutrition? What would you say like her nutrition level is?
Nutrition is okay, doctor.
Okay. And does she have any sort of developmental problems or like in school, like reaching the milestones or anything like that? Have you noticed anything? Teachers said anything?
No, no
No?
issue.
Okay. Sorry?
No
No
issue.
issues. Yeah, all right. And is she growing well, like in terms of like her height and her weight, do you think?
Yeah, it's okay.
Okay. And does she complain of preferring like a cooler weather or a warmer weather?
She didn't mention to me anything.
Okay. Do you think that she complains of any like coarseness of voice or skin or hair fall?
No,
No? Okay. Any tremors or anything like that?
no, doctor.
No. And what is she like in school? Is she what about physical activity? Does she enjoy physical activity? Is she able to do physical activity?
Yeah, she likes that.
Okay, so she's still attending school then?
Mm-hmm.
Okay. This might sound a little bit odd, but then since she is 12, do you know if she's had her period or had any tummy pains that might have been leading up to a period?
Not now,
Not now, so not yet?
not yet. Yeah,
Yeah, okay. Do you know if she's got like has she started you know, puberty yet, like with armpit hair and
yeah,
stuff?
she
She
has.
has?
Yeah,
Yeah. So you think overall she is normal, but growing normally, but she's just haven't had her first period. Yeah?
yeah,
Yep. Okay. Has she complained of any wee and urine urinary issues or like constipation or anything like that?
no, doctor.
No? Okay. And can I ask okay, so I'm going to have a look at Alice and do a physical examination, and then I'll come back to you. Is that okay? Can I
Yeah,
examine her? Yeah.
yeah.
Okay. Thank you. Hmm. Okay. Thank you, examiner. The examiner. Um, uh, okay. Thank you for being so patient. So I've had a look at Alice and her examination. So it looks like she's got like a lump right in the middle of her throat that moves when she swallows, right? But it doesn't move when she sticks her tongue out. And it's soft, it's not hard, it doesn't seem to have any irregularities in it. So I wouldn't be like I don't want to alarm you that it's not a tumor or anything that's that serious, okay? So but I right now my what I think it might be is that she's got a thyroid issue. Do you know what thyroid is?
What's that?
So we all have this gland on in our neck, right? And it helps us regulate our body temperature and a lot of other things in our body. So her thyroid has been acting up a little bit more than usual, and it might be because her thyroid is releasing these hormones, but her body is not recognizing the hormones. So her thyroid has to over produce the hormones necessary for her body to react to it. So that's why she's got this enlargement of the thyroid. It's called hypothyroid. That's one of it. The other reason, which I thought it might be, it could be like a cyst in the like a thyroglossal cyst. Although it might be unlikely at this point, because when she sticks her tongue out, it doesn't follow. Usually the gland, the thyroglossals, the pipe, like sort of like it's like a pipe way. It sort of connects to the tongue. So when she
Okay, yeah,
sorry.
no, that's okay. Very nice performance, doctor. Did you book your exam?
Yeah, I already booked my exam in June 13.
Fantastic. It was really nice performance. How you like took a history, that was fantastic. Fifi, my suggestion would be like you can discuss with mom. So that would be really nice approach. Like if you are discussing about physical examination finding to the mom. Diagnosis, you mentioned thyroid related issue, very clever approach, I would say. So it's a thyroiditis case. Sometimes like look, I'm not 100% sure if you are mentioning it's a thyroid issue that covers like everything, like it could be hypo or it could be hyperthyroidism.
Yeah.
But yeah, because thyroiditis is very common according to this age group.
Okay.
You can mention about other all the thyroid related problem because your task is diagnosis and differential in this case. So
Okay.
but based on the history, if your predominant assessment area would be history, I would say you will pass that case.
Oh, that's
Yeah, but
amazing.
yeah, but diagnosis and differential, like that's a little bit tricky. So if you mention it's a thyroid related problem, that's okay. But you need to mention like all. It could be due to autoimmune thyroiditis, like subacute thyroiditis or grave disease, thyrotoxicosis. Like just try to mention all differential as much as you can. Because as I mentioned, sometimes predominant assessment area is diagnosis and differential, not history.
Okay.
So in that case, making a correct diagnosis definitely like is the point to pass. If you're
Okay.
not making a correct diagnosis, you are not passing that case.
Okay.
You understand what I mean?
Yeah, I do understand. Yeah. Thank
Okay,
you.
so let's discuss the case. You are a
Okay.
GP. Alice came with her mom because of neck swelling. She's a 12 years old girl, generally healthy. So task is history, BF, diagnosis, and differential. So in this case, ask about all the, because it's a neck lump, what could be our differential for neck lump? It depends. If it's the middle of the neck, we can consider it is a thyroid related problem. So think about hypo, thyroidism. Ask about like autoimmune thyroiditis, Graves' disease, thyrotoxic or thyrotoxicosis, goiter, it could be, or thyroglossal cyst. Um, for any like right or left side neck lump, so your differential should be different then. Because if it's a right side neck lump or left side, you need to think about either it's a cervical lymph node enlargement or not. It could be Pankos tumor, or it could be due to, any lipoma, sebaceous cyst, those things. Okay. So just be mindful about like where is the position of that neck swelling. So ask about details question about the neck lump. How long has it been there? Do you think is it getting bigger? Where is the lump exactly? Point either is in front of the neck or just any side of the neck. Did you feel the surface? Any redness, ulcer over the lump? Any complaint about pain? Swallowing problem? Any recent cough, cold, fever? I ask about symptoms like that is feeling tiredness, uh, feeling dizzy, fatigue, weight loss, or weight gain history, weather preference. How about her pee and poo? Ask about family history of any similar problem or thyroid problem. Um, Ask about growth and development, any other social issue, any family history of any thyroid problem, as I mentioned. Physical examination, so they mention like it moves with deglutition, but when tongue protruding, it doesn't move. Okay, but there is no redness, no lump, and when you palpate, like you feel it's a smooth surface, firm consistency, non-tender, lower margin palpable. Okay, others findings are normal. So based on that history and physical examination finding, my professional diagnosis is a thyroiditis because it's a very common causes in Australia. And ask about like I'm going to draw a picture and I'll discuss that one. If you have any question, feel free to ask me. So our neck, in front of our neck, there is a butterfly-shaped gland. We call it thyroid gland, and it is responsible for producing the hormone called thyroid hormone. Okay, thyroid hormone is required for our body's metabolism. So in your child case, what I noticed, like it is inflamed. So it is infection and inflammation of the thyroid gland. That's why you call it is a thyroiditis, which is very common condition in Australia, according to this age group. It could be like Hashimoto-thyroiditis, which is autoimmune condition. It could be due to other causes like Graves' disease, that is another autoimmune condition. It could be just a multinodular goiter, thyroglossal cyst. It could be due to lymph node or sebaceous cyst, okay, which is coming from the skin. Or it could be lipoma, just fat tissue swelling, okay, but those are less likely. Yeah, physiological goiter, that could be, but uh, in this case, you can just mention about any simple goiter or multinodular goiter as your differential. But as per the age group and physical examination finding, that is like thyroiditis case. Yeah, you can say I'll draw a diagram. So in your online exam, you can take a paper and marker. So that would be more prominent when you are drawing something. Why not lymphoma leukemia? Why are you thinking about lymphoma leukemia? Was there any feature for lymphoma leukemia? So history, there should be feature of night sweats, low-grade temp for a long time, chills, rigor, sweating, weight loss history, nothing positive in here. And also like that could be due to bleeding from anywhere, especially for leukemia. So, and lymphoma, did you notice any lymph node enlargement for anywhere? If no, so those are less likely. If management in your task, so in that case, I would say is a immediate and long-term management. For immediate management, I would go for blood test first. So just do all the basic blood, ABC, UVC, LFT, definitely TFT, full THase, T43 level. We are going to check, and also for scan, I would prefer for ultrasound thyroid. Okay. And based on the findings, your management would be that if it is thyroid issue like hypothyroidism, you need to like start with thyroid hormone treatment. If it is a hyper, so again, it could be like either you are going to prescribe beta blocker, antithyroxine medication or not. So depends. And also you can mention long-term management. You are going to refer this patient to the endocrine specialist, okay? Definitely, you can say malignancy as ADD. Remember papillary thyroid carcinoma that is common in young population. So always keep that one in your diagnosis. So ask about any malignancy history. Okay. In your main exam, they allow you to put any paper. I'm not sure for a whiteboard. So you can draw a picture in online. So what happened in my online exam, because I was the first candidate for online exam. So initial like 1 or 2 Ks, I tried to draw something, but I noticed like that kills my time. So I stopped drawing and just start explaining. But my advice to you, if you have a time and you can draw with marker, because simple paint, it's very hard to see on that camera, okay? So you can use the marker paint. So that will be like more prominent. Okay, so let's move to the next case. Who wants to perform next? I prefer new candidate. So any new candidate wants to perform? Yeah, Dr. George. Hello.
Hi, Dr. Cynthia. How are you?
Hi, I'm good. How are you?
Good, good.
Okay, this is your case, and your 2 minute starts now. You can start.
Hi, Sam. Good evening. My name is Georgia. I'm one of the doctors to assist you today. Um, nice to meet you. I understand from your notes, Sam, that you came to visit due to postcoital bleeding. How are you feeling today?
I'm okay, but doctor, I'm really worried about it, doctor. Is it like why I'm having this bleeding, doctor?
All right, Sam. For us to understand what's going on, I would need you to ask you a few questions. Will that be okay?
Okay.
All right. So when did this happen? Is this the first time that it happened, that this bleeding?
Yes, doctor.
All right. So is there any pain, associated pain?
No pain.
No pain. All right. Have you quantified the bleeding? Like, have you used how many pads?
I didn't use any pad. It just came to the toilet paper.
All right. Okay. Is there any clot or yep,
Just a fresh blood, doctor.
just a fresh blood? All right. Apart from the bleeding, is there any abdominal pain, hypogastric pain?
No,
No. Have you had any fever
no.
recently? No. Um, okay. Um, the next questions that I will be asked, Sam, is quite sensitive, but rest assured that everything we will be discussing is confidential, okay?
Mhm.
All right. When did you had your, what age did you had your first menstrual period?
Mm, for like first time I have when that was
First, yeah, yep.
maybe when I was 13.
Yeah, when you were, have you having a regular periods, monthly periods?
Yeah.
Yeah. Um, Do you experience like heavy bleeding during your period?
No, doctor.
No. All right. Regarding your sexual history, do you have are you sexually active at the moment?
Yes, doctor.
Yeah. Are you in a stable relationship?
Yeah.
Yeah. Okay. Have you had any like previous sexual partners before?
Like before, yes, doctor. I had like one partner before.
Just all right. Okay. Um, rega apart from the bleeding, do you also get like other discharge from down below, like whitish discharge?
No.
No. Are you up to date with your HPV vaccination?
Mm,
No.
what's that?
Or it is actually a vaccine to prevent human papilloma virus. It's one of the vaccinations that usually they offer, when you are
I didn't take
in.
before.
All right. Okay. Um, have you had cervical screening test recently?
No.
No. Are you taking any contraceptives?
Yes, doctor. I'm taking oral contraceptive pill.
All right. Do you also use like condoms or any other?
No.
Yeah. Okay. All right, Sam. I'm just gonna be checking the physical examination from the examiner. I will get back to you shortly.
Sure.
All right. Dr. Cynthia, can I go back to the first slide, please? Yeah. All right, Sam. So based on the examination and the history, thank you for providing me those information. Um, the your cervix, as we have visualized it, it looks like it's inflamed. So it's red from the opening of your cervix, which is the neck of your womb. So at this stage, I'm thinking you're having a condition called cervicitis. Have you heard about this before?
What's that, doctor?
So basically, it's inflammation of the neck of your womb. But there are many other reasons as to why this is happening. But one of the most common cause is HPV infection. So based on your history, you mentioned that you haven't had any HPV vaccination for any HPV vaccination. So this is actually very important, as this is one of the most common um, um, infection that causes lesions on the neck of your womb, even nasty growth on that womb. So at this stage, I would order you to get some further tests, such as a cervical screening test, wherein we will get a sample from the neck of your womb and test for um, any infection on the neck of your womb. And do you have any questions at this stage, Sam? Are you with me?
Anything else that I need to know, doctor?
So we would also organize for you to have your HPV vaccination or your Gardasil vaccination. And then based on the result of the cervical screening test, we would um, we would we would further order some tests if needed, such as a colposcopy or, yeah. Sorry, Dr. Cynthia, I'm so lost.
That's okay. Is that
Yes, doctor. Thank you so much.
time? Very kind, Dr. Georgia, and you have a very nice approach. So just a few things needs to be like brush up. So in here, history, you asked me very good history, but the key point was missing. Did you notice your patient is worried about any cancer? So did you ask me any cancer history?
Yeah, no, I forgot. Yeah.
So always like just have a like broad vision. Here, even though your patient is 26 years, but cervical cancer is not uncommon condition for this age group. So just
Yeah,
ask
yeah.
about like cancer symptoms. Otherwise, like you asked me, like sexual history, um, risk factor for mm, this is a cervical ectopion case. You asked me about OCP related question. That's nice. Partner history. You asked me. Missing is malignancy. Cervical
Mm,
ectopion. Also, you need to ask about dyspareunia. So it's a postcoital bleeding. You should ask about during the intercourse. Do you feel any pain? And in between the period, do you have any bleeding history? Those things. Okay. So few like question are missing, and also ask about when your patient passing urine or passing poo, does she have any pain while passing urine or passing poo? Okay, those
yes,
things are
doctor.
missing. Physical examination finding, you mentioned it's a cervicitis, like it's a cervical ectopion case. It will be, I think, if you have picture, it will be more like understandable to make a correct diagnosis. But it's not a cervicitis case. Cervical. But you mentioned about your differential. It could be cervicitis, vaginitis. Your differential should be cervical ectopion, and
Mm,
management comes as a blood test and other. I'll explain. Okay, so let's discuss the case.
thank you,
You are at
doctor.
you are at a GP clinic. Your next patient, 26 years Sam, came because of postcoital bleeding. She's very worried. This happened for the first time, and she's worried about any cancer. Task is his TB, fee diagnosis, explain management to the patient. Um, so what could be the reason for postcoital bleed? It could be cervical ectopion, cervicitis, vaginitis, cervical polyp, cervical cancer, trauma, endometrial polyp, cancer, bleeding disorder, or any blood thinner medication. So mostly, as I mentioned, in online exam, you'll get vital sign for this patient. If not, you can say initially, I'm going to check my patient vital sign and start asking about more bleeding question. So was it related to intercourse? And that thing happened for the first time you had that bleeding? Did you use any pad for that bleeding? Any discharge apart from bleeding? Any itchiness? Any problem passing water? Any bleeding anywhere else from the body? Um, because of the bleed, you should ask about severity of that bleeding. So, do you feel dizziness, nausea, vomiting, lightheaded, feeling? Ask about period history. So Dr. Georgia, she didn't ask me about last menstrual period. Any reproductive woman, um, that is very important question to ask about last LMP. Okay, are your cycle regular? Any problem with your period? Do you experience any excessive pain or bleed during the period? Any possibilities you might be pregnant at this moment? Ask those things. Like basically, you should ask about 5 key question. Okay. How about your cycle? Are they regular? Any bleeding in between cycle? Ask about partner question. Are you in a stable relationship? Any history of STI? And do you use any contraception? What type of contraception? So OCP could be the risk factor for cervical ectopion. And in here is the key point or key question. Okay. Ask about any pregnancy, delivery, any complication during the pregnancy, Have you done any pap smear before? What was the result, or cervical screening before? Ask about general health question, and definitely all the malignancy questions. So because patient is concerned about it, ask about any weight loss, night sweat, lumps, bumps anywhere in the body, past medical history, family history of any gynecological concern, any bleeding problem, or any blood thinner medication. Okay. Physical examination finding, you might notice there is like pelvic examination. There is a like red patch over the cervix which bleeds upon touching, but cervical os is closed. No other positive findings. Um, so you can say based on the history, physical examination, I'm thinking it's a cervical ectopion. What is that? So cervix or the neck of your womb has an outer surface. So that outer surface, we call it ectocervix, and inner part, we call it endocervix, okay? So ectocervix covered by flat cell and endo covered by tall cell, okay? And those two part like meet at the squamocolumnar junction or at the opening of the cervix, okay? So what happened for the cervical ectopion? When that rim of the cervix rolls outward and exposing the inner part, okay? That means like endocervix, they are exposing into the vagina, and that's why like we notice there is a red rim, and so if it is like just a gentle touch, it causes bleeding. Okay. Uh, why these things happen? Just more common during pregnancy, teenager, and women who is using like oral contraceptive pill. Okay. Uh, so at this moment, like don't need to worry. It's not a cancer because you don't have any loss of weight, loss of appetite, lumps, bumps. What I'm going to do, management is comes with investigation, blood, urine, urine pregnancy test, hormone profile, and ultrasound you can do. And because causative factor is oral contraceptive pill, you can mention you need to stop OCP. But as you are going to advise your patient to stop OCP, you should mention at the same time use another form of contraception. Okay. If you mention like you stop OCP and you if you're not giving your patient other advice, so yeah, there is no point. Um, and for that cervical ectopion case, refer this patient to the specialist. They will do ablation procedure or cryotherapy or electrocautery based on the gynecologist decision. Okay. Advice for good genital hygiene, cervical screening needs to be up to date, and give her red flag. Okay. Yeah, that could be one of the differential. Ask about social situation. You can ask. This type of case, you should ask about cervical screening test. Co-test is not an office test, okay? So cervical screening test, you don't need to mention about either liquid-based cytology or co-test. Just mention like cervical screening test. If your patient is due for that, your job as a GP, you need to organize that one. But always remember, it's not an office test. Okay, so let's move to the last case. Who wants to perform last one? Um, Any new candidate? Hello, any new candidate wants to perform? Yes, Dr. Yumin. Are you there?
Yes, I'm here.
Okay, this is your case and your 2-minute starts now. You can start.
Hello, I'm Yamin, one of the doctor in this hospital. Nice to meet you, Monica. But I'm sorry to know that from the notes you have some knee pain at the moment. So may I ask, are you feeling the pain at the moment, Monica?
Yes, doctor, I feel pain.
Okay. Okay, so I would like to prescribe the appropriate painkiller for you after checking the allergy. So can you rate us in a scale of 1 to 10, how would you rate your pain?
Like doctor is almost 7 to 8 in this moment.
Okay, I'm really sorry to hear that it is a severe pain. I will definitely give you appropriate painkiller. Please trying to bear it well for that one, the ferrocarbon salt. So in the meantime, if you are okay, I would like to ask you some questions regarding your knee pain, and then I will be able to give her what is the possible cause of the pain. Would that be all right for you, Monica?
Sure, doctor.
Okay. So Monica, can you please tell me more about your knee pains? How did you get that pain?
So, doctor, I was playing footy and like suddenly like my opponent like pushed me and I fell down and like after that like I'm having that knee pain.
Okay. So on which side, right or left, may I ask?
It's right knee
Okay. So when did it happen? Like when did it happen exactly?
in the morning.
In the morning. Okay. So with that time, when you get the injury, did you were you able to continue in the play, or do you need to rest from the play?
Yeah, I couldn't continue.
Mm-hmm. So did you hear any pop-up sound when you get the injury?
I didn't notice, doctor.
Mm-hmm. Any and did you get the twisted injury when you get the impact?
I can't remember.
Mm-hmm. Yeah, that's fine. Apart from that, right now, can you able to bear your knee? Can you able to bear the weight
No, doctor,
with
it's
that?
very painful.
Mm-hmm, mm-hmm. So according for the pain, now I see that you have the right knee pain. Is it in the inside or the outside of your foot? Sorry, knee?
Is it like outside, doctor?
Mm-hmm. Okay. Can you describe the character of the pain?
It's a very like sharp pain, and like I can't walk, doctor, at this moment.
Okay. So does the pain move to anywhere out of your leg, like to your foot or to your thigh?
No.
With the pain, did you find any swelling, any skin changes like redness?
Yeah, doctor, there is redness.
And how about the swelling?
Also, there is swelling as well.
Did your knee give away when you get the injury right now?
I can't remember, doctor. Like I feel so tight on my knee.
All right. Yeah, that's fine. So for this kinds of injury, it is a first time for you?
Yes.
Apart from that, may I ask, do you have any fever?
No fever.
Any have you tried to touch that area? Is it very painful to touch?
It's painful, doctor.
Okay. Apart from that, do you notice any tingling, numbness sensation?
No.
Any weakness?
No.
Okay. Apart from that, any other pain in any other joints of your body?
No, doctor.
So by any chance, any insect bite or any animal bite?
No.
Okay. All right. So apart from that, may I know, are you so this is like a screening question for you, and then everything will be confidential between me and you. So since you are 15 years old, are you having your period? Any problem with your period?
No.
Okay. Okay. So apart from that, do you have any previous injury problem with your joints?
No.
Okay. So how about any previous medical or surgical condition which you are doing this for?
No, doctor.
Any medication that you are taking right now?
No.
By any chance, any bone disorder or joint problem in your family?
No.
Okay. Okay. May I ask, do you drink alcohol? And it's just a screening question. Sorry to ask you, like the screening question for the record. So, by any chance, do you drink alcohol?
No, doctor.
Any recreational drugs?
No.
Okay. Thanks for sharing your information, Monica. So, if you let me, I would like to get a physical examination for you. Would that be all right?
Sure.
Okay. 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 So Monica, I got the physical examination finding. According to your history and the physical examination, I think what you are having right now, we call it the ligament injury of your knee, most probably anterior cruciate ligament injury. Let me explain a little bit about you. So we have that knee joint, which is the junction between the leg bone and your thigh bone. And that knee joint is actually constructed and provided by many ligaments and also the meniscus, which is like a cushion between the joints. So according to the nature of your injury and the physical examination finding, that the most probable condition is the rupture or injury of the one of the ligament in front of your knee joint. We call it the anterior cruciate ligament injury. Am I clear at this far?
Yes, doctor.
Okay. There was also other possibility that I was considering. That also could be due to other ligamental injury. And also it could, like I said, it could also be due to the meniscus or washer, the cushion between the joint injury. And also it can even be due to the septic arthritis, but you don't have any fever. Sometimes it could be due to the osteomyelitis, but you don't have any other symptoms. And the osteomyelitis has the long duration of action, and the nature of injury and your symptom is not coincident with that. And sometimes it could also be due to the fracture of your knee, but the finding is not very consistent with the fracture of your knee, but we have to exclude it by doing the X-ray. And so also the cause of the knee pain could be other due to the other joint problem, or even sometimes it could be due to the soft tissue infection like cellulitis, but you don't have any history of animal bite or insect bite, so it began less likely. Am I getting to my word? I do this for Monica?
Yes, doctor.
Okay, I do this for. Do you have any question?
Yes, doctor. So, like, because I'm footy player and my competition is coming, so am I going to play? Like, how long?
Yeah, it's a very good question, Monica. I understand that you would like to play since you are a footy player, and I think you have been training
Your
for
time's
it.
up, doctor.
Oh, okay, yeah.
Okay. Doctor, it was really nice performance. Like, you didn't miss anything. It's a anterior cruciate ligament injury, but recently case came as a Achilles tendon rupture. But that is the different case. But you made a correct diagnosis. It's Achilles anterior cruciate ligament injury. I haven't noticed anything you missed in here, except like if you have time, you can answer your patient question. Okay.
Yeah, yeah.
So let's discuss the case. Recently, case came as a like cuff injury and positive findings as a popping sound. So in that case, like you need to ask specifically to your role player, where is the pain? Either it's the knee pain or the cuff pain, because knee pain you need to think about different differential, and for the cuff pain that is different. Okay. Uh, so in here you are an intern in regional hospital. Monica, 15 years old girl, came to you because of playing footy, got injured, now complaining with knee pain. So task is history, PV, diagnosis and differential. So here ask about pain medication, ask pain severity of our pain medication after ruling out any allergies, ask about pain quotient details. So how did these things happen? Asked about any twisted injury inside or outside. Ask about either she was able to bear weight or is it pain continuous or like on and off? And how about painkiller? Does it help? Pain, does it radiate to anywhere else of the body? Ask about any gives away feature for knee or weak knee. So sometimes you will get positive findings. So for gives away or weak knee could be positive. Ask about any redness, swelling over the knee area. Ask about open wound. Ask about occupation. That is also important, or any other past medical family history. Okay, so physical examination is a redness, swelling over the right knee, and movement restricted because of the pain. You might get all the special tests, but special tests cannot be performed because of the pain. It's a handbook case. So handbook case, if you can open, you will notice one of the anterior cruciate ligament special test, Latchman test positive. So based on the history, it could be ACL, ACL-TR because Latchman test was positive and knee giving away feature. It could be PCL, could be meniscal TR or collateral ligament injury. It could be patellar displacement, fracture of the knee or other joint issue. Okay. Now coming to that case, a patient complaining about calf pain, you should ask definitely about injury sign and where is the swelling or the pain, either it's the knee or leg or in the foot area. Okay, so basically like Achilles tendon rupture, symptom patient complain about like definitely severe pain, swelling near the heel area, and patient like cannot weight bear on the toe. And also like when that injury happened, patient might notice any popping or snapping sound. Okay. And also like when patient is walking, so push off So inability, patient is unable to bend the foot downward basically because of the Achilles tendon rupture. So heel movement, patient cannot do it, and also patient cannot bear weight on the toes. Okay, so those are the positive finding for Achilles tendon rupture, and patient will tell you is a calf pain or heel pain, not the knee pain. So just ask about where is the exact pain. Okay, so that's all for today. Any question for today's cases?
Can we please go back to menstrual cycle question?
Yeah, which one? Sorry, what's your question? Are you talking about fifth cases? Like, I missed your question. What's the question?